Nigeria recorded the first case of COVID-19 on February 27th, about a year ago. According to the NCDC, the country now has more than 150,000 confirmed cases. Today on Soundhealth, we will look at efforts so far in containing the virus. I am Olasumbo Modupe. Welcome. COVID-19 update is up next. Please stay tuned.
The first batch of AstraZeneca vaccines arrived in Nigeria from the COVAX facility and will be deployed to vaccinate. Minister of Health Dr. Osagie Enahire informed that vaccines that are not approved by NAFDAC will be determined as dangerous and will be seized by Customs Services and NAFDAC, who are on high alert for illegal vaccine importation. He added that no private hospital or organization has experience with handling this type of vaccine, and certainly no experience in vaccine application that NPHCDA has. Côte d'Ivoire and Ghana have commenced administering the first shipment of COVAX vaccine doses. According to Gavi, health workers and teachers are some of the first people to receive them, and 11 million COVAX doses are expected to be delivered over the next 7 days. The Nigeria Primary Healthcare Development Agency has launched an indigenous approach to COVID-19 vaccination in the country. The electronic management of the immunization data and TEACA teach strategy for COVID-19 vaccination rollout in Nigeria. In the first phase of the vaccination, healthcare workers, frontline workers, the military, police, oil and gas workers, Nigerians at the border post, and strategic leaders will be prioritized, followed by 50 and above, with priority of course for people with comorbidities. Thereafter, 18 to 49 with comorbidities will be vaccinated, as well as the rest of eligible population, that is 18 to 49 years, without comorbidities. To register for COVID-19 vaccination, nphcda.gov.ng and click on the COVID-19 vaccination e-registration. The Lagos State government has extended the work-from-home order for civil servants on grade 1 to 12. Governor Babajide Sanwo-Olu said the directive is to further stem the spread of COVID-19 within the public service and other stakeholders.
My resource person is Dr. Ekaete Tobin, a consultant public health physician with the Institute of Lassa Fever Research and Control, Irrua Specialist Teaching Hospital, Irrua, Edo State. She has been part of several outbreak responses, including Ebola, Lassa fever, and now COVID-19 at state and national level. Good to have you, Dr. Tobin.
Thank you so much for having me on the program.
Okay, it is a year since the first case of COVID-19 was recorded in Nigeria. Did you expect the current health landscape, and how has the country fared?
Thank you very much. I would say we have done pretty well. We're not new to outbreaks. We have yearly Lassa fever outbreaks. We had an Ebola outbreak in the country. So the country will be ruled on the systems we have in place to respond to outbreaks. And because of that, we were able to, in the first wave, we were able to mount a response that really brought the numbers down, flattened the curve, and brought us to the end of the first wave. So I would say we did pretty well. At the beginning, COVID-19 is a very new disease. So at the beginning, there was a lot of fear and so much mystery around the disease. But as the disease unfolded, as science came in and we got to know more about the disease, our research team, the scientists, the health workers were able to come together to mount a response, both at national, state, local government levels, that brought down the number. So I would say yes, the country did well. We did well.
Looking at emergency response.
International community, they have felt that there'll be a lot of deaths in Africa, including Nigeria, the most populous country in West Africa. But I'm very sure they were shocked that at the end of the first week, the number of deaths we had was nothing compared to the records that we were seeing from the developed world, even other developing countries in the Americas. Yes. So I would say we did well.
All right.
I felt that the government of the Nigerian government did well in mounting a good response to the outbreak.
Okay, looking at emergency response and intervention, could we have responded differently and exceptionally? Fine, you said we did well, but could we have achieved a better result?
So, before the outbreak, before we recorded our first case in Nigeria, the country had already put in place preparedness measures. So you have the national committees that were set up for COVID-19 preparedness. You have the NCDC already getting ready with a committee on COVID-19. So many of the pandemic influenza action plan before we even got our first case in the country. So by the time the first case came in, it was now time for the national and state EOCs to spring into action. And then there was a training of the rapid response teams and the deployment of the commodities to the designated treatment centers. Now, these are all processes in an outbreak response. So I think we acted the way we should have acted. And maybe at the beginning, a little bit more risk communication, but eventually, the messaging on COVID-19 went out. Even during the lockdown, there was so much messaging going around, and there was a lot of mistrust and misinformation on the internet. But even at that, the Nigerian Center for Disease Control, some professionals, bodies also went online to debunk these false information and spread the right news. So I don't think we did anything we shouldn't have done. I think we did well, considering the fact that we already are constrained by resources. I mean, we're not a very wealthy country as we were, but we were able to manage the resources we had. And don't forget that this is a pandemic that hits the whole world. So each country had to fend for itself, had to find its own solutions. So even when we started developing locally made hand wash stations, we became very innovative in our management of COVID-19. And I think we didn't do anything that shouldn't have been done. And we think that carried on the activities that we were meant to carry out as part of the outbreak response plan.
Being a new virus, there are development from time to time. How would you rate adjustment to the new normal by the public?
I would say the Nigerian public is getting, if you move around town now in many cities, people just get used, just wear their nose mask, even when there are no security agents around. People go to supermarkets, go to religious houses and wash their hands, even when there's nobody standing by to say, wash your hand. So Nigerians are getting used to not hugging themselves. Nigerians are gradually getting used to moving around, getting comfortable with moving around with the face mask, staying in crowds with the face mask. So I would say that Nigerians are getting used to it. It's a very gradual process. You do have pockets of resistance and people still saying there's no COVID-19, it's a hoax, it's a plan by government to extort her citizens. But then you also have a lot of people saying that, yes, that this is the way to go. And even in our health facilities, healthcare workers are getting used to standard precautions. They're getting used to dealing with people as if they were potentially infectious. So we see health workers wearing their nose masks. We see people maintaining social distances, even in banks. We go to banks now, even without putting markings on the floor, people still maintain the social distance. So I would say Nigerians are gradually getting used to this new normal. There will obviously be deviations. For example, we've been trying to make sure in some states that passenger buses carry a limited number of persons so that we can maintain social distancing. And it's not always work. It doesn't always work out that way. But then, even at that, you still see people saying, you hear somebody cough, and people turn away. People walk away. I mean, that didn't happen 3-4 years back. So I would say that we're gradually adapting to the fact that nose mask is important. So all these non-pharmaceutical measures are important to prevent people getting the virus. And you hear people saying, oh, because of your mother or because of your aged parents, wear a mask. I mean, people don't have to be forced or watched or threatened to do that. So I would say Nigerians are gradually, very gradually, getting used to this new normal.
Okay.
And then there's a lot of the ability to filter information on the web. Nigerians know more the credible sites. People don't accept any news on the internet anymore. They know, like 3-4 years back, remember when we had Ebola, there was
all right. Okay, all right, Doctor.
But now Nigerians go to NCDC website.
Dr. Tobin, we have gone from just a case to over 150,000 cases. Can you say we are winning the war against the virus?
With the news about vaccination, we are going to win the war. Already, if you look at the NCDC website, the number of cases the past few 2, 3, 4 weeks has started declining. So even with the precautionary measures that the public health measures that we're putting in place, social distancing, hand hygiene, and making sure that people are screened and quickly taken out of the population so that other people don't get infected, we're already winning the war. So by the time vaccination comes in, I'm sure that will go a long way to take the numbers down. Now, don't forget that several states already have security as part of the EOCs. In one of the pillars in the EOC in many states is the security pillar. And this pillar, they have all 20 pillars. So this is the pillar that enforces the public health measures that are recommended to stop the spread of, curb the outbreak and stop the spread of the disease. Now, even when enforcement officers are not out in the street, you see people complying. And that on its own is enough to bring the outbreak to a reasonable, control the outbreak to a level it doesn't become a public health emergency concern anymore in the country. So I would say that we are on track to winning the war on COVID-19 in Nigeria.
Since the first case, we have had the lockdown, first wave, and currently the second wave, as well as new variants. We are still battling with the pandemic. What more should be expected?
So now we have the new variants coming in. Unfortunately or not, our genomic surveillance capacity is still being strengthened in the country. And with this, though we're not able to sequence as many of the samples as we would have wanted to, we were able to sequence a fair number. And we're able to track the new variants appearing in the country. What we need to do next is make sure that people on their own go to when they're symptomatic or when they feel they've been exposed, continue to move to screening centers to be tested. Because if the number of people going for testing starts reducing, we will lose track. We will not be able to tell whether we are still in the heat of an outbreak or not. It's the samples that test positive that tell us where the direction we're going with the outbreak. Now, we need to keep people need to keep going for testing. Health workers still need to be on red alert. The index of suspicion has to remain high. Then we should use this as opportunity to strengthen the health systems overall, like an overhauling of our health system. So make sure that sample transportation systems remain strengthened. Make sure that health workers don't get demotivated. Health workers keep getting the requisite trainings that they need. Continue to build on the diagnostic capacity in the country. Right now, almost every state has a laboratory, a molecular laboratory. And this is again from this pandemic. It wasn't like this 3-4 years back. back. Continue to build this, and then most importantly, keep surveillance on our ports to make sure that people who are coming in to the country, if they come with a test result that is negative and they comply with all the precautions required for travelers coming into the country. So that surveillance is necessary to make sure that we don't, we quickly have this pandemic contained.
We are still awaiting the arrival of the vaccines. Did you get that, Dr. Tobin?
Yes, I did. I heard that.
We are still awaiting vaccine delivery amidst misinformation and vaccine mistrust. These are major setbacks. What should be done to accomplish expected outcomes at this time?
So now a lot of messaging should go out to the public. A lot of messaging and engage. So first of all, engaging stakeholders, engaging professional groups, engaging trade unions, engaging the public, the traditional leadership structure, making sure that people who the public look up to are well informed and are able to speak. That is paramount. Clearing the mistrust and the doubts, the misinformation. Then using the social media platform, because a lot of Nigerians rely on social media platforms for information, to spread the right information on the COVID-19 vaccine. Making sure that health workers are briefed. So a vaccine hesitancy is not only seen with, it's not a new, it's not new to Nigeria. We have it with polio. Remember in 2013-14, there was this fear of polio vaccine. So it's not, I mean, up till today, you still see people refusing to get their children vaccinated. So addressing vaccine hesitancy is very important at this time. Making sure that information is available on social media platforms. And then the other part is making sure that the logistics structure is ready for rollout of the vaccine. So if you need transportation, so that plan has to be laid out. And the plan, scrutinized so that bottlenecks are identified and measures, gaps structures are put in place to lock any gap, any hindrance, any obstacle, any delay, anything that will cause the people to start fearing COVID-19 vaccine should be addressed at this stage. So the PHCs that will be used as fixed post, the cold chain boxes, the immunization, whoever needs to be trained, all that should be planned now. I think that is really what should happen at this time. And then a lot of the government coming on to tell the people about the vaccine and clear fears and doubts is very important.
Genomic sequencing is an area the country needs to work on to understand ongoing transmission of diseases. What must be done to accelerate these aspects in disease prevention?
So, the ASG, African Center of Excellence for Genomic Studies, has really done so well with NIMA and NCDC in making sure that we have some capacity for genomic surveillance in the country. But that needs to be strengthened. So speaking to raising scientists who will go for training in genomics, making sure that if we want to use regional labs or tertiary labs, but equipment need to be procured. Sequencing is very expensive, very, very expensive. The country must be ready to allocate money, budget money for sequencing and promoting genomic education, both at tertiary level. So at undergraduate level, there's an undergraduate program, either tied to laboratory science or, it's built into the university structure. And then at postgraduate level too. And designating laboratories, equipping them to do genomic analysis on not only COVID. I mean, there's Lassa, there are so many infections for which sequencing tells us the strains in the country, the travel history of the viruses, and what more to do. So strengthening that capacity will need building it into the university system, either at undergraduate or postgraduate level, making sure that scholarships are available, not only for in-country training, but people want to go outside to train. that capacity is available. That fund, that provision is there. And then equipment are provided to the tertiary hospitals or labs that are designated labs that can carry out sequencing. That would also, and then promoting research, very important. Research, the structure we have for research is really very weak in this country. Promoting research, people should conduct studies on sequenced viruses. That will encourage more people to go into the field. Very important too.
Okay, genomic sequencing no doubt cannot be overemphasized, but in your response, you pointed out that we need to scale up testing, especially now that we have outbreak of Ebola in Guinea and DRC Congo. Are you hopeful this is ending soon, and what should be done to conquer this virus, Ebola virus and COVID-19?
Okay, we don't have Ebola yet. We don't have Ebola in Nigeria, but
True.
COVID-19, if we can continue to sound the message of social distancing, use of nose mask, hand hygiene, if we can continue to make sure that the diagnostic labs across the country have the support, the reagents, the consumables they need to keep testing, if we can continue to ensure that states are supported, the emergency operation centers in states are supported to carry out their surveillance, carry out contact tracing, and even without, with not much emphasis on the vaccine, that should help to bring our figures down. If we keep doing that and then maintaining surveillance at the ports so that we don't have new variants, and you see the problem with new variants is they may be resistant to the vaccines, they may be difficult to treat, they are easily transmissible, they kill faster, their mortality rates, people infected with these variants may have higher mortality than people who are not infected with the new variant. So if we do all this, we will really be on track to ending the outbreak in the country. I hope that answered your question.
Yes, Dr. Tobin. Thank you so much for sharing your expertise with us on the program.
Thank you so much for having me on the program.
All right, Dr. Ekaete Tobin has been giving in-depth analysis of ongoing efforts in containing the virus, coronavirus, since the first case was recorded in Nigeria over a year ago. She's a consultant public health physician with the Institute of Lassa Fever Research and Control, Irrua Specialist Teaching Hospital, Irrua, Edo State. Soundhealth continues with trending health reports. Please stay tuned. This is where we say thank you on the show. Remember, wearing a mask, washing of hands for at least 20 seconds, and physical distancing are key in stopping further spread of the virus. Ensure you observe these protocols at all times. For comments and inquiries, please send SMS to 08035826603 or follow us on social media at LTV Social, #Soundhealth. A sound health is a sound mind. Make healthy living your choice.